In 2025, analogue radio signal was switched off in the UK. Many radio listeners did not have access to the new DAB signal. Conspiracy theories ran rife that the British government had made this decision to silence discussion and dissent. Pirate stations became widespread, broadcasting on FM from temporary locations, which frequently moved to avoid detection, including boats, lorries and prefab sets. The following fragment is from a podcast of a discussion show broadcast on one such station, World Wireless, on 13th of October 2035. Retrieved from MP3 player recovered by Recovery Analysis Unit, RAU, the show's host is thought to be Davina McGowan, a stateswoman of the 21st century current affairs broadcasting.
Good afternoon. Pythagoras said, "There is geometry in the humming of the strings. There is music in the spacing of the spheres." On the programme today, we are discussing microspheres and their application in the field of targeted drug delivery for the treatment of a variety of conditions such as diabetes, cardiovascular conditions and cancer. Joining us for our discussion is scientist Dr. Henry Clerville from the Cutting Edge Research Team at Relay University, who pioneered this treatment through its first human trials, the data from which has just been published this week, and Sam Alcott, a professor in bioethics attached to the influential think tank Hybrid. Henry, before we delve into the radical implications for patient care and outcomes, perhaps you'd like to tell us something of the genesis of this project?
Throughout history, medical interventions have sought to extend human life beyond this mortal coil. And from earliest childhood, I've been a dreamer. So my involvement with the Microsphere Development Project was, you might say, destined. The development of microspheres for targeted drug delivery was primarily intended as a means of administrating chemotherapy for cancer treatment. Chemotherapy was pioneered in the 1940s, with the first use of what are known as antagonist drugs.
Antagonist?
Yes, well, indeed. The earliest development of chemotherapy came about as a direct result of the introduction of chemical warfare during World War I, in particular mustard gas. The name antagonist is derived from both Greek and Latin words that signify being rival, competitor or opponent, and they were born of chemical attacks which caused debilitating burns, blindness, pulmonary oedema and, ironically, cancer itself.
Sam, nearly a century on from the first usage of chemotherapy, what are your thoughts on the apparently cataclysmic results being published from this 5-year study at Relay University?
Well, if the data from this study proves to be accurate, it's not an exaggeration to say that modern medicine is balanced on a precipice, in contact with unknown spheres and powers. When Sidney Farber championed the use of folate analogues to treat leukemia, he met widespread ambivalence and even resistance within the medical community at the time. The work at Relay has been no less controversial, no less divisive, and certainly equally, if not more, significant.
And we will get to the nature of the results of the study in just a moment. But first, can you tell us, Henry, something of the background to the commissioning of this study?
Well, without a doubt, the discovery that the administration of toxic chemicals could slow, treat and even cure certain cancers ranks as one of the greatest discoveries of modern medicine. But yet, we reached a point at the turn of the century in which the numbers of people being diagnosed with cancer was rising, and rising at an unprecedented rate. And the treatments we had available were just refinements of what were being pioneered in the 1940s. So scientists began to rethink our approach, specifically regarding how treatment was administered.
And you are referring, of course, to the microspheres.
A number of options were considered. We sought to explore hormonal therapies and cytotic chemotherapy, but essentially to target treatment in order to block the growth of cancer cells more effectively, while being less harmful overall to healthy cells within the body. In the 1990s and right up until the 2020s, a variety of targeting methods were attempted and trialled, but ultimately the creation and successful application of the microsphere method proved most advantageous.
Now, blocking and inhibiting the growth and spread of disease is one thing, but has there been no consideration given to the idea of regeneration and effectively healing or revitalising cells that have been compromised?
While I was not part of the team at Relay, there is major research dating back more than 20 years investigating how zebrafish and tadpoles can regenerate their limbs, organs and tissues. The objective of this research has been to create implantable medical devices that will incorporate these regenerative properties into the human. A workable prototype of this kind has not, however, yet been successful. There has been much speculation from within the scientific community over the last 2 years as we awaited publication of results from the Relais as to whether the scope of their study has also encompassed the aim of regeneration and specifically whether the data from the zebrafish and tadpole studies had borne any fruit.
Speculation aside, it is a matter of public record that the study we are discussing today was commissioned by a private consortium in 2028, who approached Relay University to lead the research and interpret the results. As to why I am not in a position to give insight into the consortium's motivation, but funding vital, groundbreaking research into the development of a treatment with the potential to more effectively treat and indeed cure conditions from diabetes to cancer and a wide range of cardiovascular diseases would seem to be ample motivation to me.
Now, to the results of this study, Sam. It has taken close to 2 years for their public dissemination. What are your reactions to this delay from an ethical point of view?
Well, of course, in Ireland we are accustomed to our universities receiving subsidies from government to fund research and student places, although increasingly less following the Government Education Act of 2022. Relais University, however, is an entirely privately funded research institute located in Switzerland, and they are not legally obliged to share any data obtained in research studies they and the consortium financed. Legalities are one thing. However, ethically, this takes us into quite a different terrain. A reasonable delay caused by checking results, interpreting data, ensuring no results were doctored and no anomalies included in the data set is to be expected. 2 years before sharing pioneering data that is expected to revolutionise treatment methods and utterly alter patient prognosis appears to some to be indicative of a research project in which the ethos has been to leave one's humanity at the threshold.
And have you any thoughts as to the reasons for this delay, Sam? What possible benefit could there be to the team at Relais in postponing publication of their results?
One line of thought might suggest profitability. A confidential trade agreement with a multinational pharmaceutical company, giving them a 2-year head start on developing patented microsphere technology. Another reason could be that the microsphere project is just the tip of the iceberg, a front for a much more extensive project, the existence of which Relais denies and the nature of which can only be speculated. The microsphere study may be, according to this line of thought, a red herring from the main project objectives.
And, of course, we must refrain from this type of speculation.
I am quite simply appalled. Look, I agreed to be part of this discussion in good faith, to contextualise and interpret the study's data for your listeners and to engage in genuine scientific debate. This discussion is veered into tinfoil hat territory. I'd expect little more from you, Sam, or anybody from Hybrid for that matter. But I rather thought this programme would hold itself to higher standards, and yourself as well, Davina.